Thank you so
Good
much.
evening, good afternoon, and good morning. This is the 1635th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. NAVEED Iqbal AWAN from Pakistan. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathy lovers, students, and doctors. And we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. And from 8:30 to 9:30, we have the international session in English. And from 9:30 to 10:30, local language session in Malayalam. We are uploading the videos on the same on the very next day itself so that those who missed the session can watch it again. You can subscribe the same without paying any money. You can share it with your friends from all fields, that is homeopathy lovers, students, and as well as doctors. Then we have a presentation from 65 countries in this forum from homeopathic doctors, eminent personalities, and all the presentations were really excellent. As you all know that we have started these sessions at the time of pandemic of COVID, and that really enabled us to connect in between. So this is all about the introduction, and let me come to today's guest. As you all know, Dr. NAVEED Iqbal AWAN has completed DHMS and MSc in Applied Psychology with the additional clinical psychology, and he has completed MSc in chemistry also. He is a psychologist, relationship therapist, homeopathic consultant, international mentor, member of the Psychological Association of Pakistan, national and international forums. Dr. NAVEED AWAN has successfully treated over thousands of patients in the career spanning over many years, and he presented many cured cases on international forums and as well as in our Zoom sessions also. All the presentations were brilliant, really brilliant. And he has a vast experience of curing incurable diseases like diabetes, chronic kidney diseases like failures, allergies, depression, arthritis, hypothyroidism, gout, plastic anemia, surgical cases like kidney stones, uterine fibroids, ovarian cysts, warts, tumors, enlarged prostate, behavioral abnormalities like phobias, disobedience, etc., like sucking in children, thumb sucking in children, epilepsy, etc. He has completed his DHMS from Rawalpindi Homeopathic Medical College, and he is an MSc in Applied Psychology with additional clinical psychology, and then master in chemistry that we have discussed here. And as you all know, he is a follower of Saigal School of Medicine. Saigal and is a brilliant presenter in that field also. He has presented some of the best cases in this forum earlier, and Dr. NAVEED is already having this forum, and Doctor will be discussing about management of nephrotic syndrome with homeopathy. And we proudly welcome Dr. NAVEED AWAN to this forum. Welcome, Doctor.
Thanks, Dr. Dinesh. Thank you very much. And good evening to all of the respected colleagues and all of the respected honorable team of the IFPH. So can I start?
Yes. Yes, introduction
yes,
is already over.
Okay.
Yes, it is coming. Yes.
Okay.
Okay, fine,
So
fine.
today my case is management of nephrotic syndrome with the homeopathy. I'm going to share with you very beautiful case, and I will discuss you that what happened during the case and why I changed the remedy from one remedy to another remedy. So please be in touch with me. Dr. Dinesh,
Yes.
you will admit I think because it is going to disturb me.
Yes, sir, definitely. I am here to admit, and you just go
Okay.
ahead with the
Okay,
presentation.
thank you. Thank you. Thank you. So nephrotic syndrome in the children. These are some of the body symptoms of these patients. That what happens when they suffer from the nephrotic syndromes. And like this, the edema of the whole body, or the eyes are swelled, legs are the swelled, and protein in the blood, urine. So what is the nephrotic syndrome? It is a condition in which kidneys release an excessive amount of protein in the urine. In healthy kidneys, glomeruli filter out the waste products. They allow your blood to retain the cells and proteins your body needs to function regularly. Damaged glomeruli allow the blood proteins to leak into urine, including albumin. So which cells are the responsible? Damage to podocytes, which are the epithelial cells responsible for forming the glomerular filtration barrier, leads to urinary loss of plasma proteins. So replacement of adult podocytes that have been lost in the disease need to derive from the stem or progenitor cells. Here are the symptoms that large amounts, greater than 3.5 grams of the proteins albumin in the urine, high fat and cholesterol levels in your blood, swelling, edema, usually in your legs, feet, or ankles. Swelling may also occur in your hands or face. Low levels of albumin in your blood, loss of appetite, feeling unwell or sick, abdominal pain, foamy urine. How does nephrotic syndrome affect my body or patient body? If you have nephrotic syndrome, losing the different proteins may cause the various problems. Some proteins help prevent blood clots. When you lose those proteins in your body, blood clots can form. Immunoglobulin are the proteins that help your immune system fight disease and infections. So when you lose the immunoglobulin, you are at the greater risk of general infections that affect the different body systems, including pneumonia, cellulitis, peritonitis. Who does nephrotic syndrome affect? Nephrotic syndrome can affect anyone. However, it's the most common in the people with the diabetes-related kidney disease, people who have allergies, and people who have a biological family history of the kidney disease with nephrotic syndrome. So caring for your child, if your child has been diagnosed with the nephrotic syndrome, you shall need to monitor their conditions on a daily basis to check for the signs of relapses. You shall need to use a dipstick to test your child's urine for proteins the first time they urinate each day. The result of the dipstick test are recorded as either negative when it contains 0 milligram of the proteinuria per deciliter of the urine. And if it is trace, there appears a trace on the report 15 to 30 milligrams plus 1 minus 30 to 100 plus 200 to 300 and then plus 300 to 1000 and then plus 4 over 1000 milligram per deciliter. Is nephrotic syndrome curable? Mostly we see or listen this question. I will go through the different treatments. No, nephrotic syndrome isn't curable. However, nephrotic syndrome often goes away in children once they reach their late teenage years or early 20s. Treatment helps relieve your nephrotic syndrome symptoms and prevents the further damage to your kidney. AC blocker, beta blockers, statin, diuretics, anticoagulant, and antibiotics. Mostly these are used to cure the patient. So now the case of nephrotic syndrome. This is a case of teenager suffering from nephrotic syndrome, having two siblings. His father is laborer and mother is a housewife. The case was referred by the homeopathic doctor and taken on the call on 5th December 2024. The symptom he narrated are as under. I have been suffering from this disease for 1 year, taken a lot of treatment but have temporary relief. Now swelling increase on the whole body and it is difficult for me to do routine work. I am very worried about the health and of this swelling. I have tendency to think about this disease, cannot lie down or the walk. I fear that I become more ill before. This anxiety overwhelmed me that I have become ill and cannot do the work nor play, nor go anywhere and start weeping. My friends are enjoying playing and talking all what they want, but I cannot. I feel envious to see them and wish I could too. Doctor advised me to hospitalize and I do not want to go. Fear of hospital make me more worried. So I ask, what do you do then? Patient, I have tendency to sit down and start thinking over disease. I want to be recovered to get rid of the disease. Then I ask, is there any tension you take? Child replied, only of this disease. So this is the case. Case was solved taking the mind symptom. Redos software is used to collect the rubrics, and rubrics were taken from the following repertories: Xanthus Adonis, Phatak, Murphy, Bonhazen, Nur, and Kent. These repertories were used to take the or to collect the rubrics. So going through all the case, following rubrics came to my mind. What was the child talking about? Anxiety. And what was the anxiety? Anxiety about disease. So first rubric was taken here, anxiety, general disease about. Here the 17 medicines are there. And again, next rubric was fear, anxiety, fright, disease of. Here are 9 medicine. Then what the child said, I am ill. The child perceived that he is ill and he cannot go to anywhere, he cannot do anything. So the rubric is here, delusion sick being work and for this season will not. There are 4 medicines, Calcarea, Causticum, Naxomica, and Sepia. Mind envy. Here are 84 medicine because when the child see others are playing, going to anywhere, and they are enjoying the delicious food, this child is envy of that other children's. So what the child say, fear hospital going to. Child said that the doctor advised me to be hospitalized and I have the fear of the hospital. So here are the 4 medicine, Argentum nitricum, Calcarea, one is rare medicine and Kalisol. Then what the child do? Sitting inclination to sit, meditates, and the child say that I have the tendency to sit down and to think over the disease. So here are 15 medicine. And then what the child wants, he wants to cure up, light desire for. And then next rubric is weeping anxiety after. There are 29 medicine. So summing up of all these rubrics, the medicine was Calcarea carb. I have started Calcarea carb 6C, BD for 3 days, and then hold the medicine and wait and see. So what was the first change in the child? Swelling decrease, almost disappear. Spot protein on 5 December 2024 was 1365, 1365. So after taking the medicine, swelling reduced to 449 on 7 December, and then 30.3 on the 11 December 2024. Spot protein further reduced to 7.2 on 14 December 2024, which is normal. Child remained normal, no swelling. But what happened? Again, the protein level, spot protein level increased up to 166 on 13 December 2024. Again, I repeated the criteria 30. Again, everything normal, swelling become normal. Then again, spot protein increase up to 2,543 on 2nd January 2025, and swelling again appears. Calculated 200, one dose was repeated. Spot protein reduced to 3.2. You see here, on 2nd January 2024, the protein level was 2,543, and it reduced to 3.2 on 24 January when the test was repeated. But again, it increased to 661 on 7 February. Then what happened? Again, remedy was repeated in 1M, 230, 6C, but no change and swelling get more worse. Even I used LM potency, but no any change. No potency was working, so I again reanalyzed the case. He said, again, I discussed with the child that, tell me what happened to you, what you are thinking, what is in your mind. Again, share with me. So he said, again, swelling appeared and protein level increased. I am very anxious about the disease and have weeping tendency. I start the weeping when I speak or someone speak to me. Due to this disease, I have become docile and feel the weakness and does not take any enjoyment in anything. I feel myself helpless and frustrated. I fear disease will become more worse and incurable. So I have taken the calcarea carb on site and again take the peak symptoms. What the child do? Only taken those symptoms. So what was? Sitting inclination to sit weeping with. Here are only 9 medicine. Only 9. You see here, Ambra, Calcarea silicate, Simicificus, Cyclamen, Pulsa, Sepia, Acid Sulf, Veritum. These are only the 9 medicines. So I've taken this rubric here. And then what the child say? I start weeping when anyone speak to me, I speak to someone. Weeping spoken to one, here are the 15 medicine. And then next rubric is light desire. So last rubric is here. Fear disease of impending incurable of being. Here are 39 medicine. So summing up of all these rubrics, the medicine was Semicifigua, 30. I have given him only 3 doses. Only 3 doses. Now imagine what is the result of this Semicifigua, where the calcarea carb failed. And the start, lot of work it did. But then calcarea start working. Now what the Semicifigua did? No swelling next day. In the evening, I have repeated 3 doses. And next day, what happened? No swelling next day, urine increased to 100 ml. In the third day, 200, then 400 ml, swelling disappeared. Spot protein 15 on the 18th February 2025, which is normal. In pathology report, urine protein nil. All other tests were normal. Urine output is 800 ml per day. Until now, the child is living an easy life, no swelling, no any other medicine he is using. Just wait and see. I share the all pathology reports with you, and you will astonish to see the miracles of the homeopathy. You can see here, is screen is
Yes.
okay. So this is a child, 14 years. Now, then when I see him, his scrotum is so much swollen. You can see here. And this is the lab test, which indicate 1365 14, 5 December 2024. So after here, I have used the calcarea carb, 6C, 3 days BD. Then what happened? Swelling reduce.
Sir, still the case analysis is there. No,
Yeah, achha, okay.
Okay.
Right. Okay. Achha,
Slide is stuck somewhere.
yes.
This is not moving.
Okay, let's see. Again, I see share. Visible?
Yes,
Not
now
visible?
it's
Okay.
visible.
Okay. This is a child, 14 years, teenager. So when I have taken the case on the call, this was a condition of scrotum, the swelling so much increase. This is the report on 5 December 2024, 1365 spot protein was there. Then after using the calcarea carb, scrotum swelling reduce, and then it became the normal. No swelling is there. You see here 1365, then 449, and then 30.3. Next report is 7.2. It became the normal. But it again increased to 25, 130. You see here, here I have used the calcarea 30. It reduced to 3.2, but again it start increasing, and then 661.1. No calcarea carb work there. Even I repeated here 30, 200, 1M, LM, 6. No medicine work there. And then I have reanalyzed the case. CMC figure 30 is used. So here is the report. It is 18 February 2024. You see here in this report, protein is nil. And here, spot protein only 15. This report is from the famous Mayo Hospital of the Lahore. Remaining electrolytes are normal. So this is a child Are you listening, everyone?
Yes, yes.
It is audible?
Audible, but sound is less.
Sound okay. Just see here, I from mobile because speaker volume is, I think. Okay, just see. अस्सलाम वालेकुम, मेरी आवाज आ रही है? Is it audible?
जी वालेकुम सलाम डॉक्टर साहब, डॉक्टर नवीद साहिब।
आप थोड़ा सा कैमरा सही करो, ऐसे। हाँ, यस। अच्छा, ये बताओ कि आपका नाम हसन है या फरजाम है? क्या नाम है आपका? किसी रिपोर्ट में हसन आता है, फरजाम। तो हसन क्यों लिखवाया हुआ है फिर? हाँ, अच्छा, पहले हसन था, फिर नाम चेंज हो गया फरजान। ठीक है, अच्छा, ओके। अच्छा, बताओ कैसे हो फरजान? क्या सूरत हाल है? तबीयत कैसी है आपकी?
Yes.
ठीक हो? खेल रहे हो? अच्छा, आप खुश हो? रिपोर्ट ठीक आ गई आपकी? अब तो खौफ नहीं आता किसी बात का? अच्छा, और और क्या चीज सूरत हाल है? यूरिन ठीक आ रहा है अभी? So this was the case of a child. Okay. I see the both faces of calcarea carp and semicifuga. Here are some precautions for the nephrotic syndrome, and I also manage the child with the food and the other precautions. So, what are the precautions for nephrotic syndrome? They are the reduced amount of the fat, eat a low salt diet to help control swelling and reduce the amount of liquid in your diets. Here is, I will share the theme of both medicine, calcarea and semicifuga. So first, the calcarea carb. Basic theme of calcarea carb is inertia. Calcarea is prepared from the oyster shell, and its origin tells us much about the psychology of the type. The oyster is one of the less dynamic creatures of the sea. It prefers to stay safely inside its shell, clinging to a rock for the security. Inside its shell, it is soft and amorphous, and its activity revolves around assimilating the food and digesting it. The calcarea carb individual is slow, solid, down to the earth, plodding. Calcarea is content to stay at home and watch the television, preferably with someone to cuddle and a good supply of high-calorie nibbles. Calcarea may stay in the same job for 20 years despite having the ability to take on something more demanding, because calcarea is change aversion. They do not go for the change. The conservative tendency can be seen in many areas of calcareous life. Calcarea children, in the particular, are wary of the new experiences. They will be slow to the experiment with the new foods, slow to make the new friends, although sociable with the existing friends, and reluctant to consider different philosophies and the points of views as they get older. Calcarea simply avoid the change and within the confines of the familiar circumstances, able to relax and be indulgent to far greater extent. Security is Calcarea principal concern. Simplicity of Calcarea car. Calcarea is an uncomplicated person, being oriented primarily towards the physical reality and to the satisfaction of sensual appetites and the equally natural enjoyment of the family life. Food and clothes are the two of her principal sources of pleasure. Most of her money goes towards them. It is the calcareous connection with our physical senses and with the earth that enables us to maintain its simplicity. So next is calcarea, parochialism, and the pettiness. Traditional, he is a traditional prejudice. Calcareous interests usually revolve around the satisfaction of the needs and the desires of herself and her family. This can give the rise to certain clannish mentality, which could be roughly expressed as you are okay if you are one of us. Since Calcareous focuses on the family, Calcaria is often a collector, and some Calcarias collect the information rather than antiques and toy cars. Calcareous tends to be graze on the information. I have highlighted it. First, calcium is the principal element in the bony skeleton. Like the bones of the skeleton, the Calcaria individual performs a stabilizing or even structural role in the body of society. Calcareous are the good actors, the salt of the earth, solid, dependable. So with sound common sense and a generous heart for anyone who is accepted into their wider family, the stranger may be treated with some caution, but once he has demonstrated his good intentions, he is allowed into the oyster shell to enjoy the homeness and comfort for its interior and the pearls of love and loyalty. Both male and female Calcarias have a love of home and nurturing tendency which makes the guest feel like part of the family. The Calcaria parents will be just as supportive and indulgent as the Calcaria's partner, but in a relaxed way. Family life comes naturally to Calcaria, and the children 55 are generally nurtured without being smooth and allowed to fly the nest without much fuss. The Calcaria mother will most probably worry about her children after they have left the home, but she will not stand in their way. It is a Thou Calcaria still has a natural psyche, which instinctively knows what is best for her family without having to think about it. Just as the birds accept and even encourage their youngs to fly the nest when the time is right, so Calcaria parents perform their natural role and then step out of the way when the children are old enough to fend for themselves. So sentimentality of the Calcaria car. Water is said to be symbolic of the emotions, and the sea in particular is often associated with the subconscious mind, which is full of emotions from the past. It is appropriate then that those remedies that are derived from the sea, Calcaria, Natramio, and the sepia, correspond to the emotional personalities. Calcaria is a little less emotional than Natrum and sepia because she is so grounded in her senses, so down to the earth and pragmatic. Calcaria are dullness and obstinacy. Like Brighta and Calcaria child tend to be slow in developing, but unlike the former, he does usually catch up pretty quickly. For example, the Calcaria child may be very late in the teething or may start to crawl and walk a couple of months later than the average child. Speaking and learning to read may also be slow at first, and this initial slowness leads to later fears of overextending himself. Calcaria is not so likely to become the aggressive like tuberculinium, but rather dull and obstinate like Brighta. One way to distinguish the dull Calcaria child from the dull Brighta child is to remember that children are far more shy than the Calcaria children. Like Silesia, Calcaria lacks the stamina, both physically and mentally. Even the brightest of Calcaria individuals can have the troubles completing the prolonged mental tasks, and the attention span be too short to concentrate for long. In Kent repertory, it is mentioned no ability to sustain the prolonged mental effort. So Calcarea child is usually very good at saying no, digging his heels in like a donkey when he is pushed to do something. If you want to change the behavior of Calcarea, you are more likely to succeed by telling him to do the opposite of what you want him to do. So Calcarea's stubbornness is sometimes expressed as prejudice against the certain individuals, whole section of the society, and the concept which are the unfamiliar. The more Calcarea is afraid of the change. So it was the basic theme of the Calcarea. Now I also gave the touch to semisifiga themes. I have only shared the one rubric here, delusion sheep seeing. Sheep seeing. So what is the sheep? Here is the only single semisifiga. Sheep are often associated with helplessness, submission, conformity, or lack of independent thought. Seeing the sheep in a delusion state may indicate a perceived loss of individuality, feeling controlled or being led blindly by the others. And this such patient experience these delusions may indicate or may express his symptoms as, like they say, they feel like they are the part of the herd, blindly following the others without personal will. Believe that people around them are submissive, weak, or easily manipulated. Feel powerless, as if they lack the ability to take the control of their own life. So that was the case, and I gave the touch to the both remedy. You know, the both remedies are very vast, but I gave the single touch, a little touch to the both remedy to understand, to make clear to you. So that was the case and the presentation. Thank you very much. Also share the analysis of the case, please. Just 1 minute, please. Go to the next, please. These groups were first selected criteria. It is a chart of the remedies selected: anxiety, general disease about, fear, anxiety, pride, disease of, delusion, sick being, work, and for this reason will not, fear, hospital, going to, envy, sitting, inclination to sit, meditate, and light desire for weeping, anxiety of it. So the here was medicine Kilkireka. But when the Kilkireka failed, I go for the next analysis, that is for semisifiga. Here I have taken sitting inclination to sit weeping. There are 9 medicines. And then weeping spoken to when, here are 15 medicines. Light desire for and fear disease of impending incurable being. Semisifiga. So thank you very much. I hope you enjoyed
Really,
the
a thrill is indeed. Nobody could believe that such thing, such a miracle can happen with homeopathic medicine, and that too
yes,
in a very small.
yes.
Because of your intense, thorough knowledge in materia medica, as well as your, as a person, you always giving rubric explanation on a daily basis. That really helps you to choose such a wonderful remedy called Simisifuga in this. Nobody ever thought that such a medicine will come. I just went through the boring material in the short time, but I couldn't find any such thing in written in case of nephro
Nephrotic syndrome, yes.
syndrome case in this materia medica. So that is the power. That means that the homeopathy is the brilliant science that works always when you are on the right. That's why when you find it very difficult to move from calcarea carb, there was a little bit of struggle going on in between whether my medicine is wrong, whether my case taking is wrong. That may be the thinking that going inside the physician. But what you did was you just take the case once again, and then you find that there is a thing called this sheep weeping. That rubric. And nobody could find that such a thing because of your intense knowledge in the rubric study. That shows that all of us need to go and study every rubric, the word by word with meaning. Dr. Naveed is a wonderful person, as well as Dr. Javed Akhtar. All these fellows are giving explanation to all rubric day by day. Those who want to study homeopathy in a better way can follow them and understand what is the real meaning of each and every rubric. That is the problem with most of us. Everybody can know what is this or that, but for example, envy and jealousy, these are two technical terms having entirely different meaning when we study this aerobic study. So anyway, it's a wonderful case. Really, kudos to you,
Thank you.
from all of us.
Thank
And
you.
it's time
Thank
to
you. Thank you, Dr. Thank you.
those who want to participate in
Thank you very
discussion,
much.
raise your hand so that we will allow you to unmute yourself and speak to Dr. Naveed Awan, our guest. Dr.
Thank you.
Indrani, we can begin.
Yeah. Thank you, Dr. Naveed, for a good presentation. Actually, some two small
Thanks a
queries
lot.
were there, which I would like to ask you. Sir, in
Thank you.
nephrotic syndrome, do you deal only with nephrotic syndrome cases or nephritic syndrome cases? Because they two are different entities. One part. Second part, should we
Actually,
consider?
I take the cases on. Yeah, sorry. Please. Yes, please.
Sir, part two is this: when selecting the remedy. Here I have encountered many problems for managing such cases. Even you have encountered it. Should we consider the pathology of the renal cortex for selection of the remedy? Because we are considering a symptomatic study of the case and we are giving medicines on the situation. So, like, should we consider the pathology and then think of at what stage of nephrotic syndrome the patient has come to us? So, kindly highlight your views on this.
Okay. You will be astonished and to listen that nephrotic syndrome, calcareous carp cover the nephrotic syndrome. When I see in the repertory, calcareous carp fall in the nephrotic syndrome. So I have taken all the other rubrics regarding, and then chain to chain it link to calcareous carp.
Yeah.
But when I have seen symmetry figure do not falls in the nephrotic syndrome in the repertories.
Correct.
I have discussed. So what was the important? Mind rubrics were important. Mind symptoms were important. First, I have taken the case. I have taken the pathological symptoms, nephrotic syndrome. I think there were 58 medicines, so on. And calcareous carp fall there. So I was very confident that my medicine is very up to the point, and it do a lot of the work. And you see here, when there was on and off, there was something going up and something going down, swelling increase. So it sometime I didn't become the desperate here. I have seen that maybe the child is taking some other foods, meat is taken there, or protein is taken there. So there is the irregularities in the case. But when I have discussed that you are taking the food, you are following me, what I've asked you, yes, he said, I am totally following you, and I am do not taking and the meat, do not taking eggs, anything. So again, taking the and repeating the different doses, different potencies of the calcareous carp, when it stopped the working, then I have seen something is missing there. Something. I again reanalyze the case. What is missing there? What is missing there? You know, one time I have given him carcinosum. Okay, carci, because the mind of the children was the carci, but didn't work. Okay. Then I've taken the peak symptoms, and that was only 2. Okay, what that you sitting in when it's weeping and weeping spoken when. Semisufiga. Okay. So, doctors, your good name, please. Sorry.
My Dr. Indranil Bavdekar. I practice in the renal field only, sir. I'm from Maharashtra.
You know, okay. Mind symptoms are very important. Yeah. And I taken both phase, mind symptoms and pathology too. Sometimes the patient's mind symptoms are more prominent than the pathology.
Like a
And when
generous.
the patient is cured at this side, then automatically his pathology covers.
Okay,
I
okay.
share with you that one patient of cancer at the last stage came to me. Her son was a pharmacist. So Simulsifiga I have selected for that. Only at the one symptoms. Shrieking labor-like pain.
Pain. Wow, great.
She said that I have so much severe pain that I scream like a labor woman
Oh,
on passing the stool. So I selected only one rubrics,
great.
shrieking labor like Simulsifiga. I
Characteristics.
have given him to use to his mother, and her size, abdominal size, reduced to very much.
Great.
So when the after 1 week, his son came to me. He was a pharmacist. He said to me, "Doctor, which medicine you have given her?" I asked Simisifica. Okay. After 2 3 days, he again visited me and said, "Doctor, I have read all the literature of the Simisifica,
Oh,
but I have not seen the tumor in the
oh.
abdominal tumor there."
It happens. Yeah, it
So
happens. It happens.
how you selected the Simisifica? I said, leave it.
Yeah,
Only focus what she is going to be cured and what how much the medicine is working on in her. Only focus on it.
yeah,
You
yeah,
see, no literature is there, just leave it.
yeah. Very
So
true.
when you take the mind rubrics, mind symptoms, sometimes you can't find the remedy in the other pathology or other there.
Very true.
So
Okay.
it is a miracle of homeopathy.
Yeah, yeah, yeah.
Sometimes we are
Yeah,
not getting successful in any case. So it is not the fault of the homeopathy. It is the fault of us because we are not reaching to the right similum.
it's an art. Yeah, very true.
Yeah.
Sir, one small question. In children, you must be also facing it. Normally, these children are steroid dependent, nephrotic syndrome
Yes,
by
yes,
allopathy.
also.
And even they
Yes.
are taking, if steroid fails, they go for a cyclophosphamide group of drugs. So in such cases, what is the role of homeopath and how we should employ the medicines? Can you guide us for this?
Yes, please. I have shared another case on the here IFPH platform, and that case was that child was taking the delta quarter, continuously using from the 2 years.
Yeah.
Okay,
Pediatricians push them for
as
steroid.
the as he stopped the using this, swelling again
Relapse,
increases. So
relapse, we must have relapse.
when they came to me for the treatment, I have advised them to just continue that medicines. So when the our medicine will start working, we will repeat the test, and when there will be positive result, then we um, limitize or skip the medicine alternate days, 2 days, 3 days, so on. So only 2 months they use a delta cotton. Another case. This case was not. Another case.
Achha.
And then no medicine, no delta cotton was used. Only the homeopathic medicine. Only
That is
homeopathic.
good. Yeah, because they go in relapse. Relapse of
Yes.
nephrotic syndrome. They go in
Yes.
relapse.
So
Very good.
similarly, sometimes the diuretics are very helpful. When the swelling increase and you are just relying on that homeopathy will only work, and the patient will be destroyed, and patient will be get more and more worse, and it will be very injurious to his health. So sometimes there is a diuretic use, or sometimes the allopathic medicines is helpful. That are the supportive your supportive medicines.
Yeah.
But the time when you select the right similum, time came that the patients are totally independent of the allopathic medicine. They totally come on the homeopathic medicine. Same here, this child was before coming to me, they was used the diuretics and plus delta quarter.
Yeah, common
When the
combination.
medicine match, I have asked him to skip the medicines, only come on these medicines. Okay,
Okay.
but when the calcareous crop stop working,
Working. Yeah, yeah.
then I have I was going on the different medicines. It doesn't mean that I have today I've used a 30 and 200 and 1 elements on the same day. No, after 2 days, 3 days, I make the gap, and then the swelling when doesn't reduce. I've asked him to use the diuretics.
Okay. So
Pyramide
thank you,
and
sir.
so
You have
on.
explained it in a very,
So
very nice
to
way.
reduce the
Hand over to
bile.
Dr. Dinesh, sir.
But when the
Thank you.
medicine selected,
Ah.
totally medicine only on the medicines.
Yeah. Okay. Thank you, sir,
Okay.
for your valuable explanation. Yeah. Correct.
Now, Dr. Sahid
You're
Hussain,
welcome.
you can
Yes, you're
speak now. Yes, Dr. Sahid Hussain, sir, you can speak now.
Yes. I am Dr. Zahid Hassan from Punjab, Pakistan. Today we've seen a marvelous lecture from Dr. NAVEED AWAN. My question is, please explain why Caleb Carb is an NV patient, but also seek for light desire. Please elaborate it, Dr. Naveed Sahib. The patient is
So,
envy, but he also seek for light desire.
Okay. Thank you, Dr. Zaid, for putting your questions, your inquiry. So what is meant by the light? Light is a ray of the hope when you want to be recovered. So when you come from dark to the light, to the hope. So light is a hope. Light is a recovery. So here what the patient said, I want to be recovered. I want to be cured. I want to be healthy. It's mean he's going to, he wants, he has a desire to go to the light. He has a desire to be recovered. He has a desire to go for the help. So rubric taken is here, light desire. Secondly, what he said, swelling is so much increased. I cannot go for the walk. I cannot play. I want to reduce it. I want to decrease it. Please decrease my swelling. Here is also light desire. At one side, he is a heavy. Now he become to light in weight. So here is the light desire. Sorry. You got clear?
Dr. Sahid, you muted. Please unmute yourself. You're muted. We cannot hear you. Please unmute. Are you still muted?
Sorry. Yes, please.
Please unmute. Sahid Hussain?
Yes, Dr. Zahid, Dr. Naveed Sahib, very thanks about your answering the light desire and the envy patient for this. Thanks a lot.
Dr. Serbi, you can speak. Dr. Serbi, you can unmute yourself and speak to Dr. Naveed.
Thank you, Dr. Dinesh. And Dr. Evan is an excellent case. Thank you so much. I remember the past times your very wonderful treatment patients and remember all of them. And I want to ask the light at the same time, want to know about something, our patients. If you say, I want to learn about my patient, my disease, and how can I treatment, how months later I'll feel better, and learn too much things about disease, about treatment, and I take these rubrics like this, mind, light, desire. And at the same time, I want to ask you, the 800 milliliters urine is a little, maybe you are treatment going on from now on, and maybe choose another remedy or maybe some other intercurrent or another. Do you have an idea in your mind? Thank you so much.
Sorry, I can't catch your questions. Please, can you repeat?
The patient's urine is 800 milliliters.
Yeah,
It
yeah.
is not enough. Maybe you are going on treat your patients, but I want to ask, how is your proceeding from now on?
Okay. Doctor, you know that why the swelling increase when the urine output is less, and for a healthy person, 800 to 1000 ml per day output. If the normal person is taking the 2 liter per day, 2000 liter per day, then 800 to 1000 is the urine output for the healthy person. So urine output indicate that there is no water, no swelling inside the body. And in such cases, the kidney failure cases ho gaya, nephrotic syndrome, in such cases, the doctor should be very, very alert, because when the urine output will be decreased, then it means the swelling will go on the increasing. So urine output indicate that how much at which level your medicine is the working. Are you going to recovery? Right? So at the first, the urine level decreased to 10 ml, and then it goes for the increasing. So it reached to the 800, which is a very positive sign. So it indicates your recovery rate.
Okay.
Thank you.
And now I invite Dr. Ramparesh sir to say a vote of thanks to the session. As just time.
Thank you, Dr. Dhaneji, and everyone. Namaskar. Congratulations, Dr. Naveed Awan sir. Very nice presentation.
Thank you.
Excellent session. Select rubrics mind. Main cause of disease, according to law of homeopathic science, is mind.
Yes.
So very, very thanks, Dr. Naveed Awan sir, behalf of whole team, IFPH. Very,
Thank you
very
very much.
thanks. Again, presentation. Thank you.
Thank you very much, sir. Thank you. Bundle of thanks, sir, for your
Thank you.
kind words and the nice words. Thanks a lot, sir.
Thank you.
Thank
Thank
you,
you.
sir. Thank you.
Ramparesh sir,
Yes.
Dr. Naveed Awan, and those who attend the session.
Thank
Tomorrow,
you.
tomorrow we will have a session from Dr. Jessica Monteria, and she will be talking about a reflective practice in homeopathy.
Right,
With
sir.
that,
Okay. Sure, I will.
thank you all.
Sure, I will join. Thank you, sir. Thank you. Take care, and once again, thanks all your respected teams.
You can watch the video of the same at IQBAL Homeopathy at YouTube.
Right, sir. Right, sir. Okay. Right, sir. Thank you, sir. Thank you.
The evening. It's over to Dr. Manoj to moderate the Malayalam session.